Hi. In a few hours, your teeth will start to move and they may feel slightly tender. This should only last for 3 or 4 days, but we suggest you do 2 things. Firstly, to be on the safe side, take painkillers. Ibuprofen is especially good, but if you suffer from asthma, stick to paracetamol. Aspirin tends to interfere with tooth movement, so give it a miss. Secondly, give your teeth a rest. Stick to softer foods such as pasta, noodles, rice, soups. All can help. It's normal for the brace to rub against the lips and the cheeks. This should only happen for the first week or so after they've been fitted, but it can reoccur throughout your treatment, which might lead to mouth ulcers. To help with this, use the special wax given to you at your visit.
How do I use the wax?
Good question. Roll a pea-sized ball of wax and place it on the area of the brace which is rubbing. It's a good idea to dry the brace first with a tissue, as the wax will stick better. If an ulcer develops and becomes uncomfortable, then use some mouth cream on the sore area, such as Bonjela teething gel or Ambisol. We can't use really strong glues like those we use for fillings and other dental works, as someday we want to remove your braces and we don't want to damage your lovely straight teeth in the process. So you need to be extra careful. Lots of breakages means adding time to your treatment. So here's a few tips. Avoid hard, sticky or chewier foods. Definite no-nos are toffees, chewing gums and French breadsticks. Harder, healthier foods, such as raw carrots or raw apples, should be cut up into manageable chunks. If you think your teeth are biting onto the brace, then be extra careful. Biting too hard will cause bits to break off the brace. If a bracket does come off and your appointment is more than a week away, then call us for advice. If you are quite active and play contact sports, then use a mouthguard where necessary. Don't pick at the brace or chew pens, pencils or fingernails.
Can I still have chewing gum?
Yes, as long as it's sugar-free and of the stick variety. It's really important that you keep your brace, teeth and gums clean, as a build-up of plaque can cause puffy and bleeding gums, bad breath and horrible staining. Exactly. So here's a few tips. Brush your teeth after every meal, or at least 3 times a day. Perhaps buy a travel toothbrush so you can brush them if you're eating out. Start on the side of the brackets closest to the gums. Press the toothbrush firmly so that the bristles go between the teeth. Start on the upper teeth first and move from one side of your mouth to another. Then go back and clean the other side of the brackets, reaching to the tip of each tooth. Now do the lower teeth. Once you've done that, don't forget to clean on the inside surface, working your way one side to the other for upper and lower teeth. Last of all, clean the biting surfaces. Electric toothbrushes are fine if you have one. If you don't, there's no need to buy one. Time yourself. It should take about 3 minutes to clean your teeth properly. Use interdental brushes to clean around the brace and under the wire, where food and plaque can get trapped. Your regular toothbrush will miss these areas. Interdental brushes are really good for cleaning around the gum margin, particularly if the brace sits close. These small brushes are essential, so remember to use them. There's different sizes of interdental brushes available, so choose one that suits you. Use a fluoride mouthwash last thing at night. This will help to strengthen and protect your teeth against damage. Still looks bad? Check the label. There needs to be 0.05% fluoride in the mouthwash. Use disclosing tablets. These are coloured chewing tablets which release a dye absorbed by the bacteria in plaque. Chew 1 tablet and spit out its contents. Now have a look in your mouth. Now you can see where the bugs are, so get to work with your toothbrush. Damage to your teeth is not only caused by poor brushing. Sugary foods and drinks can do the same thing. You see, the bugs in your mouth love sugar as much as you do. But when they're exposed to it, for example, when you have a fizzy drink, they produce acid which damages your teeth. Fizzy drinks are particularly damaging, even sugar-free drinks, as they're acidic. So watch out. Take our advice and don't have sugary snacks between meals.
Can I still have sweet?
If you have to. Every time you have a sugary snack, bacteria produce acid for 30 minutes. Depending on what you've eaten, this happens after meals as well. So that's the best time to sneak in a tasty treat. But don't do it every day.